My name is Raymond Price. I am a general surgeon and trauma surgeon at Intermountain Medical Center, but I also serve as the medical programs coordinator for the Swanson Family Foundation, a private nonprofit group working in Mongolia.
When I took over the foundation, I wanted to look at a broader horizon. What can we really start to do?
Our goal is to try to work ourselves out of a job and have them be the leaders in doing laparoscopic surgery, and this is already happening.
My first impression of Mongolia was kind of interesting for me. It was like going back in time to the United States in between about 1880 and 1890.
Mongolia is a wonderful country. It is the least populated country in the world. But half those people live in the capital city. The rest of the people live out in the countryside. And even in the capital city, many of the people live in a gyr or a yurt. It's a one circular room felt tent.
The Mongolian people are very warm and open.
The doctors that we work with, the nurses, were just unbelievable, gracious, wonderful, wonderful people.
Once you get outside of the city, they call it the land of blue sky for a reason. It's absolutely gorgeous.
Transportation was probably the most difficult issue.
Travel in Mongolia is, I think, an adventure. Some people think it's difficult. I think it's fun.
So you fly in and you land at the main airport, and there's like cows walking across the parking lot.
For people that would be traveling outside the city, you eventually get to a point where the Mongolian freeway takes over. And the Mongolian freeway is nothing more than a bunch of paths, a bunch of dirt roads going different directions. Travel is at best challenging, and at worst impossible.
The hospitals in Mongolia are something that you would probably think you would have seen here back in the 40s.
Surgical instruments that were 20 years old.
And in many cases, they would reuse a disposable item until they truly couldn't use it anymore.
Doctors would say, I'm going to do surgery on you tomorrow, you need to go and find suture.
The supplies are non-existent.
Then when we started looking at the medical infrastructure in the hospitals, it was probably worse than the buildings.
Dr. Segerlin, who was the chief of surgery at the University Hospital, also somebody who was very involved in working with the WHO, gave me a little talk about why she thought they needed to have help in expanding laparoscopic surgery throughout Mongolia. Dr. Nimhu was the first surgeon to do the first laparoscopic cholecystectomy in Mongolia. Those people having done laparoscopic surgery had very few wound infections. Those that had the open incision had 12 to 15% of them had wound infections. And since 1994 until about 2005, still only about 5% of the gallbladders were being removed laparoscopically.
I've seen these laparoscopic cases in the United States. And then I was looking down, and then I thought it will be good to have in our country.
We could not do this without the support of various companies. And so I really wondered, is this something that could be done in Mongolia? They were very insistent. And we came home and began to develop relationships with many different companies, asking if they would be willing to support the initial phases of teaching laparoscopy in Mongolia.
And he's going to, do we want to know what hospital they're going to?
We were looking for all the basic equipment, the TV cameras, the light sources, the scopes, the CO2 insufflators, even the basic supplies of sterile gloves. And we were quite surprised that many of the companies were very willing to support this kind of project.
Swanson Foundation does not only training. The Swanson Foundation has provided for us a lot of instruments and equipments. Without those equipments, that achievement could not be achieved.
In countries like Mongolia is different than in other developed countries. I mean, we don't have enough equipment in medical care.
Trying to develop supply lines that people can get their own equipment at an affordable price so that they can be sustainable and not rely on donated supplies. Some people have really questioned whether or not it's good to teach laparoscopic surgery in a developing country. It seems like the whole country needs to have the surgery done.
Many of the patients want to have this new technology in the medical care, and then get the less pain, short-term stay in the hospital.
You don't need to teach somebody how to use a landline phone before they learn how to use a cell phone.
Yes, we have to develop laparoscopy in Mongolia, not only in capital city, but also in bigger cities of country, of course.
We've taken it to the capital, that's fine. How are we going to take it out to the countryside? But Dr. Segerlin said, no, we need to take it there. We have a lot of people there, and travel is too difficult in our country. We have to get access to this to all of our people by taking this to the 4 regional diagnostic centers.
Yeah, Ogden is very far away from Ulaanbaatar. It's 1,500 kilometers. And patients or who has some problems with gallbladder stones, it's difficult to go to Ulaanbaatar. It's very expensive, and here is doing a wonderful job.
We begin to set up a course to teach all the surrounding hospitals, bring in the doctors from the country hospitals to teach laparoscopic surgery, emergency surgery, even basic medical care.
Even though Mongolia has today economic or social problems, but we need to develop our surgery. That's why we need laparoscopy.
The surgeons learn the procedure very well.
My primary responsibility in going in advance of the team is to make sure that the hospital infrastructure could support what it is we were going to do. That could include everything from making sure that the electrical wiring and the plugs and everything else would be available for the amount of equipment that we'd be bringing into the space.
I tell our teams every time we go, plan on something going wrong, and then figure out how to have fun solving it.
What you think is going to work perfectly very rarely did.
CO2 insufflator is either out or we're out of CO2. We think we have CO2.
Yeah, we used it acute.
But we're not sure whether or not the insufflator now is not working and we're trying a new one.
We had a situation where on the very first day, he started to do his very first case and the laparoscopic glide source blew up. So we had to come up with a real-time solution while Dr. Price was actually standing there with scopes inside of a patient waiting for us to come up with a new light source.
But what is most exciting is to see not only our team, but more importantly the Mongolian team work through those problems, solve the problems, find solutions very quickly that allows the surgery to continue on and be safe.
We feel like we've done a lot for medical practice in Mongolia, training biomedical engineering technicians to maintain the equipment that we bring them.
Our biotechnicians are extremely important. We couldn't do this without them.
They don't have the kind of training that we get here in the U.S. We would teach them Ohm's law, what not to do, and how to properly troubleshoot so that they would not injure themselves or others.
Over time, we have really tried to transition from being a team of American doctors teaching Mongolians to a partnership where now we train with the Mongolian doctors and the American doctors in the courses that we go teach.
I said, молодец, it's Russian, very good.
They go over for a longer period of time in the intention of not doing, but teaching the surgeons and the nurses